It's a tough act to follow with John going first. I want to talk a little bit about our organization and what we do and try to tie that into how it intersects with the issue of school shootings, although that's not necessarily our primary purview. We are a organization comprised of healthcare providers, healthcare workers, and healthcare scientists. And we were founded in the mid-90s in response to a coordinated effort by medical academia to undermine people's exercise of gun rights. There are two messages we have. Number one, firearms are not a public health issue. The academic establishment is attempting to get the notion into the public consciousness that guns are a bad thing like cigarettes or drinking excessively. The fact of the matter is misuse of firearms is a criminological issue, and part of our efforts is to direct attention to that idea. Next, and that's something I'll be talking a little bit in greater detail, is that taxpayers' money should not be used to agitate against their rights. Since the 80s, there has been a cottage industry of medical researchers, public health people who've been working very, very diligently to get certain ideas into public consciousness and to degrade the appreciation for the right to keep and bear arms. Our initial involvement in the fight was actually in the mid-90s, in the 1996 congressional hearings that gave rise to the Dickey Amendment. Our founder, Dr. Timothy Wheeler, was one of 4 physicians who testified to the House Appropriations Committee, demonstrating a pre-existing bias in medicine and medical academia against the right to keep and bear arms. Now, ever since then, there's been a lot of talk, like John said, that there is not enough research being done. Well, as John demonstrated, and as much of our work demonstrates, that's just simply not true. They're cranking at full steam with all kinds of research publications. Now, there is much room to explore the causes of criminal behavior and misuse of firearms, but these publicly funded academics don't want to do that. They have a pre-existing bias to convince people that guns are bad, and if they can't do that, then they're not going to do the kind of research they want to. Here's some historical record of how far the bias against guns goes. In the 1980s, CDC official Dr. Patrick O'Carroll, in an interview to the Journal of the American Medical Association, said, "We are going to systematically build a case that owning a firearm causes death." That gave rise to an infamous 1993 publication by Kellerman, which used a very small subset, a very small sample, I believe in Seattle, in a high crime area, incorporated, looked at the rates of gun ownership and associated fatalities or injuries in the house. It included firearm suicides in that data, and then extrapolated that to the rest of the nation, suggesting then that you are 3 times as likely to be killed with your gun if you have a gun in the home. It's a study that's been soundly and roundly debunked, but for a time, if you were a Kaiser Permanente patient and you went to see your physician in the 90s, there were posters on doors to doctors' offices that said as much. Mark Rosenberg was the director of the National Center for Injury Prevention. This is the part of the CDC that deals with violence and injury, because obviously guns are not a virus, but since they can't really make things fit that way, they would like it to be. They want you to think that injury to the user is a direct result of intended use of the firearm. Like cigarettes, if you smoke a cigarette, it's going to be bad for you if you do that for a prolonged period of time. Well, they want you to think the same way about guns. And that's in fact what he said. We need to revolutionize the way we look at guns, like what we did with cigarettes. Now they want you to think that guns are bad, they're risky, and they're dangerous to you. Deborah Prathrow Sith, she was at the Harvard School of Public Health from 1990 to 2008. Later in that tenure, she was actually dean of the school. She is now at Drew University School of Medicine, right here in our own backyard. This is straight out of her book. My own view on guns is simple. I hate them. I hate guns. I cannot imagine why anyone would want to own one. If I had my way, guns would be registered. If they were guns for sport would be registered, and all other guns would be banned. If you're active on Facebook, you can look up a young lady by the name of Bindu Kalesan. She's a young lady of Indian descent who is now at Boston University. She has published a number of studies, epidemiological studies, basically making the case for gun control. Her Facebook page was filled with anti-gun, gun owner-hating memes for days on end. We actually did an expose on this. If you go to our website, drgo.us, look up that name. Search for her name. You will see all screenshots of the kind of things she would say. And this is the pre-existing biases representative of the culture in medical academia, in public health academia. David Hemingway is also another person to watch. He is professor of health policy at Harvard, at the Harvard School of Public Health. In a recent interview that was on Vice.com, and you can probably still find it there, it's a video that talks about smart guns. He outright states that, well, you know, changing people's behavior with guns is too hard. It's a lot easier just to make it harder to get guns. And that's what he sees as a preferred course of action to reducing gun violence or violence with guns. So what we have is just a tip of the iceberg here that demonstrates an institutional bias, an institutional culture that sways one particular way. These people are all either coming out of Boston or out of Maryland, out of Johns Hopkins, where the CDC is. Anybody who does any kind of work in public health and gun control, like Garen Wintemute, who is at UC Davis, they originate from there. They've done their training there. That culture is coming down from those two centers, and it's propagated through all institutions throughout the nation. Now, going back to something I said a little earlier, public health is not medicine. There's this sophistic sleight of hand that because they're physicians, they're telling you something that's good for your health. Public health is not medicine. It's a branch of the law. It's a discipline which concerns itself with implementing policy, affecting behavior and affecting policies for all of society. It does use epidemiological data, but it's not a medical field. And it's the primary tool through which medics and doctors and people in the health industry who are opposed to gun ownership utilize to convince you that guns are bad and you shouldn't have any. Their research is designated from the ground up to undermine your rights and to undermine your perception of your rights. They will do studies such as a gunshot wound is one of the most terrible things a child can suffer. So ban AR-15s and 30-round magazines. They do a lot of bloody shirt waving in their research and tie that in somehow to a foregone conclusion. Their agenda is restriction, regulation, or banning of firearms. And any way they can pull at your heartstrings to get you to think that that's a reasonable and unavoidable conclusion, they will do it. They also use a term called gun violence, which we are somehow adopting. And it's a buzzword that sort of detaches the root of the problem from the manifestation of the problem. It's directly intended to demonize guns rather than to point at the true root of the problem, which is a sociological and a behavioral one. Now, this research gets spread throughout the media. The media carries a lot of water for it. So what are we doing? Well, two ways that this is trickling down to your average person on the street, an average American, is now what you're seeing is if you go in to see a physician for a rash, you get a history. They'll ask you, do you smoke? Do you drink? Do you wear your seatbelts? Do you have a smoke alarm? Do you have guns in your home? For a rash. So one of the ways we're responding to that is we've launched a free referral service wherein physicians, and we're mostly in need of primary care physicians, internal medicine, family practice, and pediatricians. We are trying to help people who want to see a physician about a rash and not be asked if they have guns. So what we've been doing is for some time we've been taking registration from physicians and other healthcare providers who want to see patients, expand their practice, but also do so in a way that respects people's privacy and their Second Amendment rights. And people who are seeking a physician can contact us and see if we have somebody for them. The other thing that we have been focusing on extensively is something that arose after the Isla Vista shooting. California was one of the first states to pass a gun violence prevention restraining order. This is basically a framework where concerned family can go to a judge and say, my son, brother, father is acting in a way that is concerning and dangerous. He has guns. Maybe we should separate them from their guns. Now, on face, that sounds like a good idea, but I think there's 5 states that have something similar to this. There are some failings with some of these legislations, and we're trying to educate the public about them so that if you are involved in any way, or even if you can contact a representative when such a legislation is being voted on, you can help enlighten them. We do recognize that there's a balance we have to strike between preventing your 65-year-old demented grandfather from shooting his neighbor over an unpruned tree, which has happened, and preventing a disgruntled lover or soon-to-be ex-wife from really, really ruining your life. So that these are the recommendations we think are important for these gun violence restraining orders, or as in other states they're called extreme risk protection orders. And notice the language. The language is always sounding like it's aiming towards a good and benevolent end. It's a noble cause. This is a little dense, but I'll summarize. A lot of issues we have with these protocols is they lack due process. A lot of times they're ex parte, meaning you're not even part of the hearing. So it's important that if the accused should have a chance to show up at the hearing, defend themselves, and appeal the ruling. We also recommend that there should be consequences for somebody who makes false accusations. Because if you precipitate a course of action that will strip a person of their legal and constitutional rights, you've done a lot of damage to that person. And somebody shouldn't walk away with impunity from doing something like that when they did so with bad intent. We also think that if there's major mental illness at play, there should be measures established to help people get help. Finally, if you get your rights restored, your guns should be returned to you. Your guns shouldn't be cluttering evidence lockers. Sheriff's department shouldn't be making range toys out of them, or being melted and thrown into a bin in some public display of virtue signaling. So those are our two main areas of action. To learn more about us, our website is drgo.us, and 2adoc.com is our service through which we seek to help people find doctors who don't badger them about guns. Alrighty, I can take questions. Please.
Any comment on the epidemic of virtue signaling?
Mass hysteria. In the back, yeah.
Yeah, do you get ostracized by fellow physicians when they understand your position on the Second Amendment?
Personally, I stay pretty closeted because my employer is a very public institution. Although it's you know, if my boss were to Google my name, he'd find me. Go ahead.
Was there a particular person or politician who started this kind of bias in the medical field?
No, I think it's the natural fabric of human nature. There will always be people who are homophobic, people who are bigoted, people who are this way or that way. As long as there was and there will be humanity, people will be born with certain tendencies. Those are liberty-minded and those are, individually minded. And they've just found a voice because the media carries the water for a lot of these issues. And there's a culture within medical academia that sort of reinforces this way of thinking. In the back, you got missed.
There are a lot of people who would put forward the argument that psychotropic drugs, there's almost one-to-one correlation with psychotropic drugs and school shootings.
No.
And mass shootings.
No. I actually do functional brain imaging for a living, and I do imaging of patients who are on and off medicine. The problem is not the drugs. The problem is that these people are really, 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 really screwed up. And yes, and they take meds, and sometimes the meds are misprescribed, and a lot of times they get off the meds. I got news for you. People who are really, 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 really screwed up don't like being on meds. A lot of times they're off the meds when they've done it. Does that mean that they shouldn't be on meds? Does that mean that drugs don't cause issues? Well, you know, in medicine we have a saying that if it doesn't have any side effects, it has no effects at all. But in psychiatry, you've got to be very careful what you prescribe and how you prescribe it. And psychiatry is the only specialty that doesn't image or test the organ it treats. So are you surprised those stickers that Scientologists give out are any less popular, that psychiatry is hurting or killing our youth? To some degree, yes, because it's easy to not pay attention to what you're doing and misprescribe a medication. But inherently, it's not the drugs that come first. It's the really, really bad psychology that underlies it that comes first. Over here?
Wait, I didn't ask my question.
What? Go ahead.
But I think you've answered it. Because my question was, and I'll disagree
Go ahead.
where you went with that. My question was, given that the use of psychotropic drugs has so profoundly penetrated treatment of the elderly and children, school children, etc., is there any part of the medical establishment that is looking into the possible correlation or causation relationship here between the use of psychotropic drugs and the mass shootings? And I think you answered the question, which is, no, the medical community doesn't look at that because they already have a particular opinion.
Yeah, their paradigm doesn't allow for certain things. You know, after a lot of high-profile suicides and killings, some of the SSRIs received black box warnings. Well, yeah, those are valid things. If you give a person a drug that decreases the activity of the part responsible for impulse control, and that person already has bad impulse control, you're going to make their impulse control even worse. But you have to think in those terms when you prescribe medication. And not every psychiatrist, you know, a lot of psychotropic drugs are prescribed by family practitioners. Does that mean they're incompetent? Not necessarily, but they're probably not the most specialized persons to be looking at seemingly straightforward psychiatric cases. Over here?
So,
I'm sorry, the jacket, and then I'll come back here, and then we'll do one in the back.
Do you see any evidence of attempts to impose
questions on children about whether their parents, certainly through the schools where you are teaching them everything, exposing them to everything in the world, do you see any evidence that somebody is concocting a way of giving surveys to children whether their parents own guns? Are there any guns in the family in order to sort of out or denounce these parents?
I haven't seen proof positive of it, but I'm not surprised it isn't. You know, the success of the Parkland survivors was not because they're really savvy with Facebook. It's because deans and people with tenure at major academic institutions helped them get the logistics and the funding to get it done. That being said, I have a kid in first grade. Their school had a walkout on the 17th. And I said to the principal, 6 months ago, they're eating their own boogers, and now they're socially conscious? Yes, for the most part, they haven't maybe implemented anything outright, but yes, there is a culture that leans that particular way, whether it's in grade schools or high schools or colleges. Academia, for the most part, is left-leaning, and left-leaning wants, you know, less individualism and more state control. Blue shirt over here, I think I skipped over you, right?
Yeah. Do you think that people being treated for psychiatric illnesses should have restrictions on their own ownership usage?
I don't know, are they less of a human?
Can you repeat the question?
I'm sorry? Oh, do I think if people being treated for psychiatric conditions should be restricted from gun ownership? Well, that comes down to a very fundamental question for me. Is an acutely schizophrenic person who is hallucinating less of a human? The mentally ill statistically are more likely to be victims than they are to be perpetrators. However, if you're seeing things that aren't there and you're hearing things that aren't there, I would suggest that you are not in full capacity to exercise self-determination. So I think we need to walk very cautiously about how we approach this. Because at the base of what guides my thinking about who should and shouldn't have rights is a recognition of their humanity. Whether that's a 65-year-old person who's at the beginnings of, say, Alzheimer's disease, or a 25-year-old who's acutely psychotic and wearing a tinfoil hat on Sunset Boulevard. And then we had where was I going? Last one. Okay, over there.
So one of the things that the gun control advocates propose a lot is to restrict gun ownership to mentally ill, which there's loosely defined. And since a large percentage of the population is taking some kind of anti-anxiety, and how would the medical community even approach that, and how would government even approach it?
Well, it's a slippery slope and a sticky wicket, isn't it? I'm actually going to be on PBS tomorrow talking about this very thing, because Garen Wintemute has put out a recommendation that people with mild cognitive impairments should have a talking to about their guns. I don't have the answer. The question is, do we have evidence that people with anxiety or minimally debilitating things, you know, things you take a pill for and still get up and take the kids to school and go to work, if those people are any less safe? But then again, safety before your rights as a human is kind of a concerning scheme for me. Certainly, if you're exhibiting violent ideation, we have laws on that right now. With James Holmes in Aurora, he had expressed homicidal ideation to a psychiatrist. And that psychiatrist was duty-bound to inform the law enforcement agencies, which I think she may have done or may have dropped the ball. But that's a starting point for me. I'm not terribly comfortable in parsing out criteria, because once you go down that path, it's like you kind of want to have things very clear and precise. You know, what is the cutoff for it? At the same time, you don't want to create too much of a restrictive regime. Finally, remember, the minute we start thinking about things like that, it becomes our new normal. And then 1, 2, 5, 10 years down the line, our normal has shifted, and now we're willing to accept other encroachments. So we have to consider this very cautiously. Thank you.
Thank you.